There's lots of information out there about how we should be protecting ourselves and others from COVID-19. Definitely, the best practices for prevention against COVID-19 are these measures: social distancing, staying home, especially when ill, not touching your face, and washing your hands. As researchers learn more about COVID-19 every day, guidelines may expand to adapt to the new information, so we should also be adaptable as we stay informed. One of these measures is the new CDC recommendation of wearing face coverings in public. Coronavirus travels in droplets called respiratory droplets that are propelled from the spray of a cough or sneeze. But research now suggests that droplets may even be emitted from just speaking or breathing and can potentially last in the air for 3 hours before falling to the ground. So how do face masks help us? There are different types, but the most common ones you're probably hearing about are N95 respirators, surgical masks, and cloth masks. Medical-grade N95 respirators have a tight seal against the face and are designed to filter out 95% of particles, even the ones that are really small, up to 0.3 microns. Coronavirus, which is even smaller, only 50 to 200 nanometers, can travel in respiratory droplets of various sizes. So we rely on N95 respirators to filter out pretty much all large droplets and most small ones that may contain the virus. Having these respirators available for healthcare providers is critical to ensure they can treat their patients without sacrificing their own health and safety, and so they must be reserved for healthcare workers. Surgical masks are loose-fitting, so are mostly intended as a physical barrier, not a filtration device. They protect the wearer against large respiratory droplets but not smaller particles, so are not considered reliable respiratory protection by the CDC. But they do protect others from the mask wearer's own respiratory droplets released from coughing, sneezing, and exhaling. Surgical masks should also be reserved for healthcare workers. The CDC now recommends cloth face coverings for the general public, masks made from a simple t-shirt, for example, for when you do need to go outside for essentials like to the grocery store or the pharmacy. Some states in the US have already started mandating this as well. Even so, the best practice is to practice social distancing and stay at home, but for essential outings, you should cover your mouth and nose with a cloth barrier. Cloth masks can act as a physical barrier and protect others from the respiratory droplets that you emit. You may not feel like others need protection from you, especially if you're not feeling sick. But the CDC estimates that 25% of people infected with the novel coronavirus don't show symptoms and feel fine, but they can still transmit the virus to other people around them. So it's a better safe than sorry practice. The only risk? You may start to believe it's protecting you more than it actually is and be fooled into a false sense of security. You may feel safer wearing a mask, but remember, it's meant to protect others around you, not yourself. The best way to keep yourself safe is with social distancing and washing your hands often and well. And once you get home, be sure to remove your mask without touching the contaminated outside part of the mask and wash it before your next use. The novel coronavirus can survive on objects from hours to days, depending on the material. Research so far estimates it can survive on copper for 4 hours, on cardboard for 24 hours, and on plastic and stainless steel for around 72 hours. This is still early research, so it could potentially survive even longer. This means that in addition to washing your hands often and for 20 seconds each time, you should disinfect frequently touched surfaces regularly, like your countertops, phone, doorknobs, light switches, and faucets. A good disinfectant is something with 70% alcohol, like rubbing alcohol. You can also use a bleach solution. These work best when you let the solution sit on the surface for 30 seconds to a minute before wiping it down. You can make your own bleach solution by mixing 5 tablespoons of bleach per gallon of water. 3% hydrogen peroxide also works if you wait 1 minute before wiping it down. Commercial wipes contain an ingredient called quaternary ammonium, which is also efficient in disinfecting when you follow the directions on the label. Be sure to never mix cleaning products because they can create dangerous, toxic chemical reactions. So what can you do when you have to leave your home for, say, groceries? A good exercise when you're out is to assume everyone around you is infected, and you yourself are as well, and act accordingly. This will keep you aware of what you touch and your distance from others. Be extra careful not to touch your face and minimize touching your personal belongings. When you get home, wash your hands immediately and disinfect any items you may have touched while out, like car keys and your phone. Your concern should be more about the people around you than the groceries you're bringing home. Your risk of being infected by a virus living on your groceries is very low, so there's no need to disinfect every item as long as you do these things. Wash your hands after unpacking groceries, disinfect countertops after unpacking them, and wash your hands before cooking and before eating, which you should be doing all the time anyways.